Hello viewers, one of the subscriber asked us to do a video on venous leakage. So this is for people who want to know about venogenic erectile dysfunction or venous leakage. In simple language we call it as venous leak. This venous leak, see, before understanding venous leak you should know the types of erectile dysfunction. One is arteriogenic, one is venogenic, third one is neurogenic, and fourth one is psychological. In venogenic erectile dysfunction, this can be identified only during penile Doppler test. Without doing penile Doppler, you can't identify or you can't diagnose venous leak. Whether it is arteriogenic or whether it is venogenic or whether it is a combined, only penile Doppler will tell us. So now, for getting an erection, see, if this is the penis, there are two cylinders in the penis and the bottom part is the urine pipe. If blood flows properly into these cylinders, actually these two cylinders are like balloons. If blood flows properly into these cylinders, then you get an erection. But if there is disturbance in the blood flow, if blood is not coming inside, then it is called arteriogenic ED. If blood is coming inside, but if it is not staying inside, during initial phase only blood starts going back through venous channels, we call it as venous leak. So now what happens is blood comes in through the arteries, and when ejaculation happens, the venous channels, the junction between arteries and veins, that complex opens up and blood starts draining back. Now when there are defective channels, arteriovenous junctions, this venous leak happens. So now when blood is coming inside, at the same time if it is going back, then erection may not come in some cases, or even if erection comes, it's soft erection, or sometimes erection comes and immediately it becomes soft. This is called venous leakage. And the treatment of venous leak differs from arteriogenic ED, because in arteriogenic ED enough blood is not coming into the penis, so you have to give medications to push more blood into the penis. But same concept, sometimes it works even in venous leakage. So now that means if some amount of blood is leaking and if you pump too much of blood inside, then it helps to have intercourse. But these medications like Viagra, high dose tadalafil, high dose sildenafil, avanafil, these medications, they cannot cure your venogenic leak. So temporarily when you take those medications, you get an erection, you can perform. But what to do to cure this problem? There are no medications to cure this problem. If it is venous leak, then you have to depend on either low intensity shockwave therapy, we call it as either piezo wave shockwave therapy or low intensity shockwave therapy. This helps in at least 60 to 70% of people with venous leakage. This helps in formation of new blood vessels. When there are new blood vessels, even when new blood vessels form, even new veins will form. So even the junctions become strong. So that is how it works. So low intensity shockwave therapy will help for this. Venous leak surgeries will help in some patients, but problem is now if there is leakage at one area, you do surgery for that area and there is no guarantee that it won't leak from some other area. So generally there are so many veins at one time, one vein can open up. If you close it, it can other 2-3 veins can open up, so you can't go on doing surgeries for each and every vein. So that is why venous leak surgeries are failure now. Nowadays we are not doing them. If venous leak is very severe, then we have to do penile implant surgery, or if it is minor, shockwave therapy will work. And there is one small device which is available, this is not available in India. there is a small device called Venocele. It's simple rubber band kind of thing which we put at the base of the penis and we tighten it. So it will avoid blood going back after getting an erection. So sometimes even soft rubber band you can which won't cause damage to the penis. If it is too tight, it can cause compression on the penile foreskin. If it is a soft rubber band, then you can place it on the base of the penis after you get an erection. That will prevent the blood going back into the system. So that will make sure that you get erection and you maintain it till you ejaculate. This is not actually a treatment option, but a small trick to maintain your erection when there is venous leakage. So these are the treatment options for venous leakage. If you have some more doubts or any doubts in andrology, please post it in comment section. We will try to make all those videos. Whatever we feel, if it is useful for the people, then we'll try to make them. We won't see, our duty is to educate people. So if we think that there is worth in the video, or a patient needs that video, we are ready to make those videos. Thank you.